And welcome again to folks who are just getting logged in here. Thank you very much for joining us. We can go ahead and get started for this afternoon. So my name is David Griffith. I'm the Director of Programs and Outreach for the Elder Initiative at the William Way Community Center. And pleased to have you all join us this afternoon for our Doctor is In program. Doctor is In is a partnership between the Elder Initiative at William Way and the Jefferson Center for Urban Health and the Jefferson Department of Family and Community Medicine, which includes their geriatrics division. And so we are fortunate to have Jefferson practitioners join us each month to discuss important health topics for LGBTQ populations. In today's topic, we will be talking about blood pressure and hypertension. And so we're very pleased to have Dr. Emma Delau with us this afternoon to lead us through today's presentation. For folks who are have come to our Doctor is In programs before while we've been doing these virtually, just a reminder that you have some options for how you enter your questions and comments throughout today's program. You can use the chat feature, which when you put things in the chat, just know that your name is attached to it. If you have anything that is more private or that you'd like to share anonymously, you can use the Q&A feature. And when using the Q&A, there is an option to ask your question anonymously. So feel free to use that if you'd rather your name not show up publicly for anything that you're asking. Folks on Facebook, feel free to pop your questions in as comments, and I'll be keeping an eye on that to relay your questions. And feel free to kind of ask your questions as we go. We'll also save some time at the end for some Q&A. So with that said, thank you again for being here, and I'm going to turn it over to Dr. Emma.
Thank you. Thanks for having me. I'm really excited to talk about a very important topic, hypertension. I'm a fellow in geriatrics. I've done a few talks, and I'm excited to be back here today. So again, please just interrupt with any questions, comments, things you want to share. So we'll talk about hypertension today. We'll talk about what is blood pressure in general, and what is hypertension. We'll talk about some numbers about how often people experience high blood pressure, risk factors, and the health risks that come with hypertension. And then we'll talk a little bit more about when and how to measure blood pressure. And we'll end with treatment for hypertension, and specifically what can you do to prevent it or to help treat it. So blood pressure. Blood pressure is the pressure of blood that goes through the vessels and pushes against the walls of the artery. So in the image on the right, the upper image, it shows how, I don't know if you can see my cursor, but here how when the heart pumps, the red is the blood that goes from the heart through the arteries to the rest of the body, to the organs. And then after the organs goes through the blue is the veins. Oh, I'm just gone. Through the veins back into the heart. The lungs have their separate little circulation. But basically, as the heart pumps the blood out from the heart into the arteries, that blood that goes in the arteries, here you can see it, causes a pressure up against the walls of the arteries. And that is what is blood pressure. So the blood pressure is determined really by the amount of blood that the heart pumps out, and by the amount of resistance that the arteries have up against the blood, basically. And so the more blood that your heart pumps out, or the narrower arteries are, or the stiffer blood vessels are, the higher the blood pressure. And blood pressure is measured in millimeters of mercury. I put this image on the right here. This is an old blood pressure device where there's the mercury. This one of the rotations I did, they had this old thing, and there's mercury in there that if you drop this machine, it's actually pretty dangerous. With the mercury could actually spill in how the older devices worked. But basically it's made up of two numbers, the blood pressure. So the top number is also called the systolic blood pressure. And that's the pressure of the force that goes into the arteries when the heart beats. So when the heart beats, that's called the systole. So that's why it's called systolic blood pressure. And then the bottom number is the diastolic blood pressure. That's the pressure that kind of stays behind in the arteries between heartbeats. So the between heartbeats is when the heart relaxes. That's called the diastole, or the diastolic period. And so the diastolic blood pressure is that pressure that's still left between heartbeats. So there's two numbers. And for example, if the blood pressure is, we call it 120 over 80. So you write it as 120-80, meaning that the systolic blood pressure is 120 millimeters of mercury, and the diastolic pressure is 80 millimeters of mercury. And important to realize, I think, too, that blood pressure can never be zero, because there's always still some blood in the blood vessels. So it's usually numbers in that range of 120 over 80. And we'll talk about the numbers a little bit more. But there's a daily pattern to normal blood pressure throughout the day. So this image kind of shows that. The red line here is the systolic pressure, and the blue line is the diastolic pressure. And if you start looking here, right before we wake up, the blood pressure spikes up. And then it kind of is higher, and in the literature, it's described as that it kind of continues to rise. The image doesn't really depict that nicely, but supposedly it continues to rise until around noon. And then we move over here. Then in the afternoon, it kind of slows down or lowers a little bit. My cursor's gone again here. Lowers a little bit. And then at night is where, when we're asleep, is when the blood pressure is really the lowest. So you can clearly see how it's lower when you're asleep and higher when you're awake. Right before waking up, it spikes up. And then you can also see that it kind of varies throughout the day. There's peaks and it goes down again. And really that's because there's multiple factors that contribute to the blood pressure. So for example, if you exercise, your blood pressure will go up for a little bit. And intense emotions, stress, anxiety, all contribute to the fluctuations in the blood pressure throughout the day. So that's normal. Now, what is hypertension? Hypertension basically is high blood pressure. Is a condition when that force of the blood against the artery walls is too high, and really persistently is too high. And then there's this thing called white coat hypertension, which a lot of people actually have when they go to the doctor or the dentist, which could be a stressful event. But even if people don't necessarily feel more stress, it could be that the blood pressure spikes up. And so then you have a high reading at the doctor's office, but then when you're home, it can go down again. Hypertension is very common, and we know that it can lead to multiple different health problems. So we'll talk about the consequences of uncontrolled high blood pressure. This chart kind of shows how there's multiple stages of high blood pressure, and kind of the numbers that come that are considered high and normal. So normal would be blood pressures that are 120 over 80 or lower. It's considered elevated when your blood pressure is between 120 and 130 systolic, and then still below 80 diastolic. All these numbers, I don't mean for you to like memorize at all, but it kind of gives an idea is that there's different stages. Stage 1 high blood pressure is considered when the systolic blood pressure is above 130, but under 140, or if the diastolic blood pressure is over 80, but under 90. I think the biggest thing if you wanted to remember numbers, 140 over 90, if it's higher than that, that's considered stage 2. And that's more of the range where it's important to consider lifestyle interventions that we'll talk about in detail, but also when the doctor might prescribe medications if your blood pressure keeps being over 140 over 90. And then there's this thing called hypertensive crisis, which sounds pretty scary, but that's really when blood pressures are extremely high, higher than 180 systolic or higher than 120 diastolic, which could come with more acute problems and complications. And so it really warrants a more emergent evaluation by a doctor. So talking about epidemiology, so it's, like I said, really common. actually almost half of US adults have hypertension, so 47%, which is about I can't even say this, 116 million people. Worldwide, it's 1 in 3 people have hypertension. And interestingly, that more than a third of people with high blood pressure are not aware that they have it. So we'll talk about that more and kind of how to go about that problem. And then a quarter of the people with hypertension only have it under control. So that means that 75% of people with high blood pressure are not well controlled. And then it can contribute to death, basically. So in 2019, they looked at hypertension as being either the primary reason for death or a contributing factor, meaning that the high blood pressure led to another issue like heart attack or stroke that, again, we'll talk about, that contributed to death for over 500,000 people in the US. So really common and can have some serious complications. And then the costs are also high at about 131 billion each year to care for high blood pressure. And then high blood pressure is also more common in certain areas of the United States. This figure shows really self-reported high blood pressure. So probably is an underestimation of really the numbers, but it kind of gives an idea that it seems that it's more common in the South and East and a little bit of the Midwest of the US, and less common in the all the way out West. And then rates of high blood pressure also vary by race and by sex. And it's more common in men than in women. And it's more common in people from African descent. So Black adults, it's most common than white adults, more than Asian, more than Hispanic adults. And we'll talk about this in a little bit too. This was a recent study in November of 2021 looking at hypertension in the LGBTQ community. And it showed that gay men and bisexual women may have higher rates of high blood pressure than their heterosexual counterparts. The study looked at self-reported data again from over 400,000 people that included 1.8% gay or lesbian and 2.3% were bisexual. And they found that gay men were 24% more likely and bisexual women were 17% more likely to have a higher blood pressure compared to their heterosexual peers. And that was after adjusting for factors that could contribute to high blood pressure too, like demographics, insurance, BMI, smoking status. They also found that gay men were 32% more likely to take their medications compared to heterosexual counterparts. And also that bisexual women may be at higher risk for under-treatment of hypertension than heterosexual women. And really, I think the findings are not too surprising, given that it has been shown that sexual minority adults have a higher prevalence of several risk factors for hypertension, like smoking, shorter sleep duration, obesity, compared to heterosexual adults. And then we also know that gay, lesbian, bisexual adults experience significant psychosocial stressors that add to hypertension and add to cardiovascular health. So overall, the authors of this study kind of said this fits into a minority stress theory. Sorry, give me 1 second. Where am I? And this may sound very familiar to you all, but really saying how, it explains how marginalized identities like sexual identity are associated with worse health outcomes. That's been known before, and really how society treats marginalized population has an effect on health, including hypertension, is really what the study showed. And then I found this study looking at hypertension in gender affirming care. and how gender affirming care, the hormone treatments, can influence hypertension. So we know that gender diverse people experience higher rates of cardiovascular disease compared to cisgender people. And this study done in April of 2021 showed that gender affirming hormone therapy raised the blood pressure, systolic blood pressure only, in transgender men, while lowering it in transgender women. And I think that shows kind of the effect from testosterone on blood pressure. Testosterone can raise blood pressure, and then transgender women could be potentially using a medicine called spironolactone, which is a blood pressure medicine too. So that may be why we're seeing lower blood pressures. I thought that was interesting. So more in general, risk factors for hypertension. Age is a big one. We know that with age, blood vessels become stiffer, and so that can cause blood pressure to rise. Race is a risk factor. I put racism in parentheses because I think that's a big part of it. But actually, there's been a lot of studies looking at why is it that people from African heritage tend to have high blood pressure at a younger age compared to white people. Why is it that people have more high blood pressure that's more resistant to therapies or get more complications from it? And some studies have shown that there's actually genetic differences that tend to have the body hold on to more salt and more with that more fluid, and that increases blood pressure. But I think a big part is also racism and the chronic stress that comes with that, that increases blood pressure. Family history, high blood pressure tends to run in families. Obesity and being overweight is a risk factor for hypertension. Really, if you think about someone who is overweight, there's more blood basically necessary to bring oxygen and nutrients to the organs. And so with that increased blood volume, the blood pressure goes up. Not being physically active, on the one hand, can put you at risk for obesity, but also can increase heart rate. And if the heart rate is higher, that's more blood pumped through the blood vessels, and with that increases the blood pressure. Tobacco, either smoking or chewing tobacco, can increase blood pressure. Too much salt in your diet, really what that does is it makes the body hold on to more fluid, and with that, it increases the blood pressure. Too much alcohol, so drinking more than 2 glasses a day, can raise blood pressure. And then stress, I think, is a really important one. On the one hand, stress hormones, so adrenaline and cortisol, raise blood pressure. And chronic stress can really raise those hormone levels kind of at a chronic basis. And so with that increases blood pressure. But stress can also lead to more behaviors that also raise blood pressure. So smoking, alcohol, eating more junk food, all of those contribute to the risk for high blood pressure. And then there are certain chronic conditions that put you at risk for high blood pressure. So kidney disease, diabetes, sleep apnea, I think are the 3 biggest ones that contribute to hypertension. Looking at causes, so there's 2 types of high blood pressure. One, the most common one is we call it primary hypertension or essential hypertension, which is really meaning that there's no clear cause of why the blood pressure is high. And this is the kind that kind of develops gradually over many years, most common one. Then there's also secondary hypertension, which is when high blood pressure is due to an underlying condition. And this is usually the type of high blood pressure that appears way more sudden and can cause the blood pressure to be higher than what you'd expect, basically, or higher numbers compared to primary hypertension, and can be more resistant to treatment too. It's harder to treat, really, because of this underlying condition that needs to be treated. So examples are obstructive sleep apnea, kidney disease, thyroid problems. There's a few congenital blood vessel defects that we're not going to go into detail, but that would be a reason that people can have high blood pressure. Drugs like cocaine, amphetamines, and then certain medications that I want to go into a little bit more detail. Because there's actually quite a few over-the-counter medications that really increase blood pressure. So I think that's important to be aware of. Really commonly used are over-the-counter pain medicines like NSAIDs. So naproxen, also called Aleve, and ibuprofen, which is Advil or Motrin. They make the body also retain more salt and more water and can also damage your kidneys. And so if you take this every day, multiple times a day for a longer period of time, it can really raise your blood pressure. And then another one that's important to be aware of, Sudafed. So the decongestants, they make blood vessels narrower, and so that causes the blood pressure to be higher too. There's other cold medicines that don't have that effect, so that's something to talk to your doctor about if you have a cold and you want to use that, at least to make sure that your blood pressure is fine. Or if you have high blood pressure, I would avoid Sudafed and try to use a different kind. Steroids can increase blood pressure. Certain antidepressants also. I think most common is fluoxetine or Prozac, and then MAO inhibitors. I put more so for completion. That's not a drug that's commonly used. And then TCAs, for example, is amitriptyline or nortriptyline. And then also certain stimulants like methylphenidate, so Ritalin and Concerta can raise blood pressure. I'm putting this in and talking about this more so to make you aware that if you're on these drugs or these medications are prescribed to you, to make sure that your blood pressure is checked regularly. Don't mean to say, if you're on fluoxetine, please stop it because it's going to raise your blood pressure. It doesn't have to, but really more so to be aware that it's important to see a doctor regularly or have your blood pressure at least checked regularly while you're on those medicines. And then there's other things that can raise blood pressure. So the drugs I just said, amphetamines, anabolic steroids, cocaine, MDMA, all can raise the blood pressure and actually can raise the blood pressure in a dangerously high level. Caffeine can also raise blood pressure. So coffee, but also caffeine pills or certain energy drinks with caffeine is important to keep in mind. And then there are certain herbal supplements that can actually also influence blood pressure. So I put some examples below, but arnica, ephedra, which I don't think is used in the US legally anymore. Ginseng actually has high blood pressure effects. Guarana and licorice, if that's taken in high amounts, can increase blood pressure. So again, not a reason necessarily to stop this, but it would be important to let your doctor know and to make sure that your blood pressure gets checked.
So Dr. Emma, when you are talking about sort of these, so something like caffeine, I have a cup of coffee,
Yeah.
It's going to do it sort of a short-term spike to my blood pressure, but it also could be over the long term raising things.
Yeah,
is that right?
That's a great question. I think everyone kind of responds differently to it too. So what for one person with 1 cup happens may happen for someone else after 5 cups of coffee. But you're right. When you drink a cup of coffee, it's a short-term spike. But if you're someone who drinks 4 cups of coffee every single day, that make over time raise your blood pressure. Yeah.
Thanks.
Yeah, no, that's a great question. And it's really variable. So it's hard to say, with so many cups of coffee for everyone, that's what's going to happen. So it's a little more nuanced. Yeah. Symptoms of high blood pressure, oftentimes there's no symptoms. So that makes it a little bit more difficult, but also explains why so many people are unaware that they have high blood pressure. And sometimes it's also called a silent killer, which sounds a little worrisome, but really because you don't have to have symptoms even when the blood pressure is pretty high. Some people can experience headaches, mostly the pressure type, temporal headache, shortness of breath, chest pain, dizziness, and nosebleeds even. But again, that's less common. And sometimes it's difficult too, because when people have a headache, the pain from the headache can cause blood pressure to go up. So it's oftentimes people get worried when they have a headache that that's their blood pressure being high, but actually it may be reversed, that the headache was causing pain, causes the blood pressure to be high. So that's, I think, good to know. When blood pressure is high, or when hypertension, so high blood pressure, is uncontrolled and high for long periods of time, it could lead to multiple health risks. So there's a long list here. I think the most common ones are heart attack and stroke, the two leading causes of death in the US. And really what happens is what you see here in this image. If blood pressure is high for longer periods of time, the blood vessels can become damaged. So all of these complications really are effects from blood vessel damage and having that increased pressure. So stroke would be the damage in the brain that can cause a clot, or even if the pressure is too high, it can cause bleeding. Heart attack is the clot in the vessels to the heart, so causes the heart attack there. Then it can be damage to the blood vessels in the kidney, so it can cause kidney failure. Heart failure is when the heart has to work hard every single time it beats up against that higher pressure. It can cause the muscle to kind of fatigue and cause heart failure that way. An aneurysm is an area of a blood vessel where it's kind of a weaker part and widens because of this higher blood pressure, which put people at risk of, or put the blood vessel at risk to leak blood, which could be life-threatening. Peripheral artery disease is basically damage to the blood vessels in the periphery, so in the calves or in the legs is common. And then it could even lead to vision loss if there's blood vessels in the eye that become damaged. Metabolic syndrome is kind of a combination of multiple metabolic things, like blood pressure is included in that, but also high cholesterol and obesity. And then it can even lead to sexual dysfunction. So in men, it can lead to erectile dysfunction. And then it can lead to memory issues and even dementia, really, because high blood pressure puts people at risk for stroke, which can cause dementia. This image kind of summarizes that too, that basically in all of the body where there's blood vessels going, the high blood pressure, if it's left untreated for long periods of time, could lead to damage in all those different areas. So when should blood pressure be checked? Ideally, every time you see a doctor, it will be checked. But the recommendation is to at least have it checked every 2 years for all adults, but over 40 would be best to be checked every year. And then there's all these, sometimes there's health fairs, or the pharmacy offers free blood pressure checks that is nice if you want to get your blood pressure checked. The one thing is that it's important to keep in mind that the devices that they use at those massive health fairs or at the pharmacy may not always be super accurate. So it may be that you get a good reading even though the blood pressure could be high, or that you get a high reading even though your blood pressure is really fine. So really, if you get your blood pressure checked, I would say make sure that if it's abnormal, to see a doctor, just to make sure, or to see really if your blood pressure is really high, or if it's if the device may have been inaccurate. How to check it? This infographic is from the American Heart Association, really kind of focusing on how to check it in the doctor's office, but also if you want to check it at home, how to do it. So it's important to relax, first of all. And so it's recommended to at least have 5 minutes of sitting still. Sometimes patients walk into our office and the MA right away checks their blood pressure, and 9 out of 10 times the blood pressure is high just from walking up the stairs to get to the office. So the 5 minutes taking some time to chill and relax is important. They're also recommending to not smoke, exercise, or drink caffeinated drinks or alcohol within 30 minutes of that you check it. And then you want to sit upright with your back up against the chair and have your 2 feet on the ground. So no crossed legs, or if your feet can't reach the ground, that's also prone to increasing blood pressure. And then you want to have your arms open or face up on a surface, so that really your upper arm is kind of at heart level. And then the cuff It's a little bit hard to see in this picture, but really should be above the bend of your elbow, so above there, and you want to measure it not over close, but on the bare arm. I think that covers all of it. And then you want to make sure that it fits too. So sometimes if you have a cuff that's too narrow or too wide, it can give you an inaccurate reading, basically. So you want to make sure that the cuff fits. So how to check it at home. I put a picture here of a kind that has been validated and has proven to be accurate, the Omron. I swear I'm not getting paid by Omron to tell you this, but there's a lot of other good ones too on Amazon or at the pharmacy. Some insurances, I think, cover blood pressure cuffs, but really most important is that you want to have a cuff that goes on the upper arm. So not a cuff that measures it on the wrist or on the finger, just because the one that goes on the upper arm is more accurate. And then if you have one, it's nice if you could bring it to the doctor's office to make sure that it's actually measuring your blood pressure accurately. And then if your doctor recommends you to check it at home, or if you want to check it at home, it's important to discuss with your doctor how often to check it. Because it could also raise a lot of extra stress if you're going to be checking it 3 times a day. Usually I recommend people to take it in the morning when they're relaxed, not after exercise or if after a busy day or maybe even a stressful day. But some doctors may recommend to take it at night. So it's good to talk to your doctor about what's good for you. And then it's nice to keep a log so that over time you can see kind of if your blood pressure is overall controlled or if it fluctuates really, and why does it fluctuate? Has there been certain factors that contribute? And that way it's nice for you and your doctor to kind of go over the numbers. And most cuffs or most devices also record or store the readings. I like to have it on paper or at least have it written down so you can kind of see the trends. So you can kind of see here, it's 118/78. So that's beautiful. And it usually also gives the heart rate. So that's at 70. I have a little video that will try to get to show how to do it at home. Give me 1 second.
Yeah.
And then
and I know there were a couple of questions that came in.
Yeah.
Let's show the video first so we can
Okay.
and then I'll ask the questions. I just wanted to let folks know I did see your questions, and we'll get to this.
Great.
Let's watch this video first.
Yeah. Okay. Let me know if you can't hear it, but it should work.
Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with the upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your 2 measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
All right. Let me get back to stop share. And then, yeah, David, if you want to tell me the questions.
Yeah, let's take some questions. So the first one, and this was going back to when you were talking about some of the medications that can impact blood pressure. So this was about HIV meds, and would HIV medications potentially have an impact on blood pressure?
I'm going to be honest. Why do I hear myself? I totally forgot to look into that, and I'm not too familiar. I think, if you know that your medicines or that HIV medicines increase blood pressure, or it's again, just like with the other medicines, it's really important that you get your blood pressure checked. Wouldn't be necessarily a reason to stop it or to switch it, but it's important to know, and even more important to get your blood pressure checked regularly. But I'm not able to comment on which one specifically. I'm very much not an expert in those medicines. I don't know is there anyone else on the call who may be more familiar?
Yes, I think your advice, and I think this probably goes in any case, that if you are experiencing high blood pressure, that talking to your doctor about, I assume that's something that you'd be able to do with a patient, Dr. Emmis, to sort of like go through, these are the medications I'm taking, and try to identify which are some of the ones that could be a factor.
Yeah.
Next one is, we talked about there are some foods or beverages that could contribute to high blood pressure. And this question is is not eating enough, or is not eating something that could cause a spike in blood pressure?
Ooh, that's a great question. I think if the not eating is coming from a place of being very stressed out, it's probably the stress that would cause the high blood pressure. So from that perspective, you could see high blood pressures when someone's not eating. But if you're not eating, more so not drinking, your blood pressure could actually drop from becoming dehydrated, could cause blood pressure to drop. If you think about not having enough fluids that you take in, there's also less blood volume. And so the less volume causes the blood pressure to go down. Not saying that you should dehydrate yourself and starve yourself to lower your blood pressure, really. But I think in the long term, it would put people more at risk for lower blood pressure. Too low.
And then, and you talked about this a little bit with some of the contributing factors, but do we know how much can be attributed to being hereditary in terms of risk?
I don't know exact numbers, but it's definitely a risk factor. Yeah, you see that heart disease in general, but blood pressures, you're at higher risk if your parents, if parents have high blood pressure. Yeah. But I don't know exactly the numbers.
Okay, thanks. So those are the questions that have come in so far. Invite folks to continue to put theirs in, and you can continue on with your slides.
All right, great questions. Let me see, how do we go? Yeah, so now we're gonna move into the management of hypertension. So I think one of the big parts is actually knowing your numbers and knowing where your blood pressure is. So that means checking the blood pressure regularly, whether you do that at home or at the doctor's office. And then lifestyle changes, I would say, is by far the most important part. And really certain lifestyle changes that we'll talk about can actually prevent high blood pressure. So if you know that you're at risk, for example, if high blood pressure runs in the family, extra important to make sure that you have a healthy lifestyle to prevent high blood pressure, but it is also a big part of the treatment. And that's actually the first step in treating high blood pressure. And then if the high blood pressure is too high, or lifestyle changes have been tried, but it remains high, then there's a whole lot of medications that work really well on blood pressure. And so a lot of people actually end up, if they have high blood pressure high enough where they need treatment, if lifestyle changes alone don't work, then in addition, we'll need to be on one or more medications. And then it's also important, there's other chronic conditions like diabetes or high cholesterol, to also make sure that those are managed well, just because altogether they put you at higher risk of the things we talked about, stroke and heart attack mostly. So let's talk about those. So lifestyle changes. I don't think this is going to come as a surprise, but regular exercise. The American Heart Association recommends 150 minutes per week. So that's about 30 minutes, 5 days a week, which is quite a lot. And I think mostly kind of endurance exercise or things where you get a little sweaty, not necessarily weightlifting, but really that type of exercise that you can do for 30 minutes, for example, and become a little sweaty, really to get your heart working well, will lower blood pressure. The other part is quit smoking, like we talked about earlier. Tobacco can raise blood pressure, so that's an important one. A healthy diet, we'll talk about that a little bit more, what exactly is a healthy diet. Limit salt, again, because salt keeps your body holding on to more water, and that raises blood pressure. So if you can limit salt, and salt really, is in a lot of foods, especially takeout things, fast food, but also just the table salt that you add to food can all raise blood pressure. Important to limit alcohol, less than 2 drinks per day, and to try to keep a healthy weight, because we know that overweight and obesity can put you at risk for high blood pressure. Manage stress, I think, is easier said than done and is really broad and looks different for everyone. So I have a slide coming up with ways to do that. And then getting enough sleep is also really important. So at least 7 hours per night, ideally, would be good to either prevent high blood pressure or to help manage it. So stress management, again, looks different for everyone. And so I think it's important to try to figure out what is it for you that helps manage your stress. So I put these different images here just because it shows how many options there are and how it can be really different for everyone. So some people need yoga or meditation. Other people manage their stress by just regular exercise like running or being on the move in a different way, gardening, or just chatting with friends, spending time with pets, or just doing nothing like the gentleman up there, just laying in bed and watching a movie or listening to music can be very relaxing and help with stress. So really important to figure out what for you works to manage your stress. And if you need to talk to a professional, that is also stress management and important, not just for the stress, but for the blood pressure too. The healthy diet, there's this diet called DASH that maybe you've heard of before. It's that stands for Dietary Approaches to Stop Hypertension. And on the image, it shows kind of what foods to limit to help lower blood pressure. So really that's the fatty meats, full fat dairy products, sugary drinks, sugar in general, and really the sodium intake. So they're saying to limit salt to 2,300 milligrams per day. I find that amount difficult, but in general, if you try to limit your salt intake, that's better for blood pressure. And then medications. Important is if your doctor prescribes medications to take them every day and around the same time of the day, and to make sure to follow up closely with your doctor, really to make sure that they help, but also that you're not having any side effects from them. So a good time frame would be to follow up in about 2 to 4 weeks, and to let your doctor know if you have any side effects from them. I wrote down a few of the more either common one or more important ones to know about. So if the blood pressure medicines, maybe if the dose is too strong and it drops your blood pressure too much, that could cause dizziness or lightheadedness. So that's definitely something that your doctor would want to know. There's certain ones that tend to cause more leg swelling than others. Increased urination, really that's because the medication works by getting rid of excess fluid, basically. So you'll see on those medicines that people tend to urinate more. But if this is something that's to an extent where it's very, very bothersome, or you can't go to your normal meetings or to work or whatever, that's definitely something that your doctor would want to know. And then there's a kind that can cause kind of this chronic cough. So if you don't have a respiratory infection or allergies or anything, and you notice that since starting that medicine, you have this cough, also something your doctor would want to know. And then this one is really rare, really not common at all, but one of them, ACE inhibitors, can cause acute lip or tongue swelling. That would be a reason to go to the emergency room, really. This could happen if you just start the drug, but could also happen kind of down the line. Again, very, very, very uncommon, but I just wanted to put that out there, that if you develop this lip swelling or tongue swelling at all, would be a reason to stop that medicine and not be on that medicine again. Basically an allergy. And then it's good to keep a list of, this is just in general, to keep a list of medications that you take, but really so that your doctors and you yourself know what medicines you're on. There's a whole lot of different kinds of medicines that work for blood pressure. And I put this image in here really not so much to teach all the names, but more so to be aware of how different drugs can work on different systems in the body. And so they all work a little bit differently, all with the goal to lower blood pressure. So the red ones, the diuretics, really work by getting rid of excess fluid. So they make you pee, which causes the blood volume to be lower, and so lowers the blood pressure that way. The yellow ones, the beta blockers, really work more so on the heart and on the blood vessels. It works on the heart by making the heart pump less frequently, and by kind of relaxing the blood vessels. And so those things also lower the blood pressure, but in a different way. The blue ones, the ACE inhibitors, and we call them ARBs, or angiotensin II receptor blockers. You can forget that name. But they both work in the kidney by also kind of getting rid of more volume, or lowering the blood pressure through kind of the system that's in the kidney. And then the purple ones are calcium channel blockers that help relax the blood vessels. And so by doing that also lowers the blood pressure. So again, really multiple different ways that blood pressure medicines can work. And there's even many other ones that we don't need to go into detail. Those are the most common ones. I put this in just because maybe if people are on these medicines, then it makes a little bit more sense. But ACE inhibitors end with the pril, so lisinopril and enalapril are examples. ARBs end with sartan. So if you're on a drug, losartan or valsartan are common ones. That's an ARB. Alpha blockers, we don't really need to go into, less commonly used, but doxazosin or terazosin, so they end in osin. The beta blockers, metoprolol and labetalol, are common ones. Calcium channel blockers end with dipine, so amlodipine and nicardipine. And then the diuretics are maybe the most commonly used. So hydrochlorothiazide is a big one. And furosemide, also called Lasix, is one really to help get rid of the excess water, basically.
And if I could jump in here again, is this the type of thing, Dr. Emma, where, you might try someone on one of these classes of drugs, and if it's not responding that well, you would switch to a different one? Or do you have sort of a go-to of what you would generally?
Yeah, very, very good question. I'm glad you asked that. There's a few ones that tend to be kind of the first choice. So a lot of doctors will start with, for example, hydrochlorothiazide, and amlodipine is used a lot as a first option. But usually, and then in people who have diabetes, we tend to pick lisinopril, for example, really because that one also protects the kidneys from the diabetes. It's a whole other talk. But if they don't work enough, it's actually usually nicer to pick another one to kind of, like I was showing here, another one that may work on a different system to have more effect together than to just keep increasing the dose and increasing the dose. And so it's not uncommon that people will end up on 2 or even 3, or if it's really difficult to control, 4 medicines that all work a little bit different to really get that overall better blood pressure control. Yeah, and then there's combination pills too that include, for example, the hydrochlorothiazide and the lisinopril that have one pill it's one tablet, but it has the 2 medications in one.
Got it.
So I just wanted to end with kind of the things that you could do really to prevent high blood pressure, but also to manage it. So reducing the amount of salt, making sure to exercise, move more, sit less, making sure to try at least to achieve a healthy weight, increase fruits and vegetable intake, and reduce alcohol intake. I'm realizing as I'm saying this, it's all easier said than done, especially managing stress. And then if you have diabetes, that's important to control. Take your medicines as prescribed. And then it is helpful to monitor your blood pressure at home and to keep a log, just so that sometimes it's just such a moment in time that you're at the doctor's office and the blood pressure can be higher. But when you're home and more relaxed, that could really show. If you have a log at home with all these blood pressures that are better controlled, then that's really important for your doctor to know, and for yourself to know too. And then quitting smoking is a big one too. So with that, just to summarize, so hypertension really is high blood pressure, very common, and most of the time you don't feel it. If it's untreated for long periods of time, can lead to heart attack or stroke. And it's important to monitor the blood pressure either at home or at the doctor's office. And again, the things you can do to prevent it or treat it would be a healthy diet, physical exercise, avoid tobacco, limit alcohol use, and again, manage those stress levels. And then if that doesn't work enough, there's a lot of different medications that all usually are very effective. And with that, I'm happy to answer more questions if they're there.
Wonderful. Thank you so much for that very thorough presentation. We do have a couple minutes. Encourage folks to, if you do have remaining questions, to pop those in the chat or the Q&A, or if you're watching us on Facebook, in the comments section. One I wanted to ask, and you had mentioned this towards the beginning of the program, about white coat syndrome. I'm just curious how you navigate that. I assume it's kind of asking people to check it at home. But is there a way that you can sort of tell when that's happening or why that's happening?
Yeah. So I think often people who have either not a diagnosis of high blood pressure yet, and then you see them and it's sky high, way higher than what you'd expect. But I usually just recheck it after talking to someone and have them sit and relax for a little bit, although I know that for most people going to the doctor is not a relaxing activity, but at least to recheck it a little bit later. And then if it's still high, if it would be the first time I'm meeting someone and their blood pressure is that high, usually after one blood pressure being high, it's not considered necessarily hypertension or needing treatment, depending on how high it is in a way. But usually I'd recommend someone to either come back or to get a blood pressure cuff at home and check it a few times in a more relaxed environment. And oftentimes you see way better blood pressures at home. And then I go off of those as long as the blood pressure cuff is accurate. So I would want someone to bring it in so that we can make sure that they get the same readings as we get. Just because you don't want someone to think that their blood pressure is fine just because their cuff is the wrong size, for example. And then, but overall for white coat hypertension, I go off of the blood pressures at home. Yeah.
Asking that for personal interest, as someone who has had some very much higher readings in a doctor's office.
It's very,
even though rationally I don't have any like fear of doctors or any of that for whatever reason in the room.
Right.
It
you don't even notice it. Yeah.
Right.
It's unfair. And the worst is at the dentist when they then don't want to do certain procedures because apparently your blood pressure is high, but it's really just,
I really just know I don't want to be here in this dentist chair right now.
Exactly. Yeah, even subconsciously.
On the topic of testing at home, if you do have a wrist cuff, which I know you said they might not be as accurate as the ones that go above the arm, but if you hold it, so the question was, holding it up near your heart, does that make a difference with the wrist cuff? I guess having the
probably. Yeah, I think it's just in general a little bit more difficult to get an accurate reading no matter where your arm is, but it may be a good idea to then bring it into the doctor's office to see if you get a similar reading holding it up as that the doctor's office gets, just to see if because if maybe it is accurate.
Yeah.
But in general, it's recommended by doctors to use the upper arm one.
I didn't see in that YouTube clip you showed, she had said to do it twice in sort of quick repetition. Is that also something that you would recommend, just to make sure that there's not, make sure that there's not something erroneous?
Yeah, that's a great question. On purpose, it was kind of on purpose that I didn't have a specific slide going into detail as to how often or exactly when to check it, just because it really differs per person. But it's a good idea to do it twice with about a minute in between, just to see if the reading that you get is really where your blood pressure is at, and to see if it maybe goes down, or if it's low, if it goes up after a minute, just to really kind of check to make sure.
Wonderful, thank you, and thank you folks for those questions.
Yeah, very good questions.